My name is Andrew Abbott. I'm a director within NHS Keno Clinical Commissioning Group in Cornwall. It's my colleague Trafina Doyle. She's chair of the Systems Resilience Operational Group. We were due to be joined by Ian Chulton, one of our clinical leads, but he has been detained in Cornwall at the request of the government, actually, around a deal for Cornwall, so he can't make it this morning. But I am joined in the audience, so I might need to ask the audience if there are any detailed questions around 111, and even phone a friend if I need to get hold of Ian. So, Cornwall, a bit like me, it's long and slim. It's 75 miles from one end to the other, and then about another 30 odd miles off land, you then get the Isles of Scilly with 2,000 people. Very, very remote. Total population is just over 500,000. So, very dispersed population. The largest town has a population of about 35,000 people. Most people live in small rural settlements, some distance from a main conurbation, and not everyone has cars, and the public transport is pretty poor. There's no motorway. I think there's one main AIM road, which is being dualled at last. We've already got 31% more residents over the age of 75 than the England average, and that is rising rapidly. We've got 13 community hospitals and one emergency department in Cornwall. We're already feeling the effects of this increasing demand. Last year we saw a 9% increase in A&E attendances at our 1ED, it's called Trelisk in Truro. We've seen an 8% increase in ambulance trips to A&E as well. Our A&E target has not been achieved for 3 years, so I'm not proud to say that genuinely I do think we have been the worst in the country at the ED 4-hour target, and we need to address that, and we are. As been mentioned already today, our 111 60-second call answering performance has been challenging also. With respect to my colleague in the audience, it has actually been the worst in the country as well. So our bid is focused around addressing those things. However, over the 2 years I've been in Cornwall, there has been a sea change in the culture and the collaboration and the leadership. System leaders, now through the work that Trafina and her team have done, share a joint understanding, a shared version of the truth in terms of their individual and collective roles in addressing performance issues. Clinical leadership is maturing rapidly, and we have a system leaders development program where we're bringing clinicians from across the patch to try and create tomorrow's leaders. We have nearly 2 years of experience as being one of the pioneer sites in integration. And what that's developed is very strong working relationships at the front line, or at the edge, as they call it. It's a bottom-up social movement, they call it. It's not a top-down must-do. And those teams coalescing around the health, social care, and the voluntary and community sector is really important. Our relationships with our two councils, Cornwall Council and Council of the Isles of Scilly, have really matured over the last year. And I think that has been recognised in the deal signed by David Cameron, our chair, and the leader of the council yesterday around devolution for Cornwall. And it's that context upon which we want to build with some specific support from the Vanguard bid. We focused our proposal on people who need urgent but not emergency care. And there are 3 principles, 3 key elements, and 2 population groups. And we're trying to keep it simple. The 3 principles: supporting people to live their lives they want in their communities, integrating at scale where it adds value, and then encouraging networks of provision and recognising that across Cornwall this model needs to flex according to the assets that are available. We're bringing together 3 elements of out-of-hospital care, a regional 111 hub across our urgent emergency care network across Devon and Cornwall, but importantly linked to local out-of-hours and community-based services to have that local knowledge and local flavour. The community-based urgent care and rehabilitation centre in Campbell and Redruth Community Hospital is an area that we are looking to champion through the Vanguard programme. And we have now pockets of clustering of primary care who are changing the way they deliver their work. Our model is for whole population, but recognises different needs for people who are generally well and those with chronic conditions who are afraid of vulnerable. We believe we can create greater efficiencies and simplify the system by recognising those different needs. So starting from a challenging inception with 111, we need to develop this regional hub and link it through technology and relationships to local primary care, both in hours and out of hours, and to the urgent and emergency care hubs. From the perspective of two population groups, people who are generally well or need information shouldn't be put through a pathways triage. If they have minor ailments, we can signpost them to a pharmacist. If they have a potentially acute condition, then yes, they need to go through a pathways triage and a clinical triage at the hub, where they can be given self-help advice or signposting to another service. And within the hub, that's what we want the 111 hub to focus on, those who are generally well. Patients with chronic conditions or who are frail or vulnerable, continuity of care is really important. So those within existing care plans, special patient notes, those on an end-of-life register will be flagged within the 111 system. And we want to be able to have an early exit from the pathway system straight through to those local out-of-hours GPs, where an appointment can be booked to attend a clinic, arrange a home visit, or speak to a local GP who understands the range of services that are available. The benefits will be improved caller experience, less time waiting, continuity of care, local clinicians taking ownership, increasing local GPs' ownership of out of hours, and the confidence and the local knowledge that that brings, with better outcomes for patients and better usage of our local resources.
Thank you. At the moment we have 12 minor injury units operating independently of services but located on community hospital sites. And as part of the Prime Minister's Challenge Fund, we've started to develop an urgent care and rehab centre at Camborne Redruth Community Hospital. It will offer a range of services, so 8 till 8 walk-in, minor injury and minor illness services with X-ray and point-of-care testing. Medical leadership provided by primary care will enable urgent GP appointments 8 till 8, delivered by a cluster of practices sharing a rota. I just want to talk a little bit about primary care. So just to tell you that a single GP federation owned by all GP practices has been established. In St Austell, practices have gone a step further to developing a model for primary care, a new model. The 3 practices have merged. They are sharing their resources and organising their work to support those who are generally well, separately from those who are chronically unwell. This is enabled by a shared patient management information system. And what they're doing is they'll offer an urgent appointment centre 8 till 8 in the middle of the town, because the community hospital and the rehab care centre is not within walking distance.
Sorry, I've got to stop you there, but thank you very much indeed. Thank you.